sucht an deis chun Lorch by meg Lorch Lasso Dahad a 3A. I welcome the opportunity to speak on this amendment on the recording and notification of termination of pregnancy. In general terms, it will assist in advancing the creation of an objective, verifiable knowledge base that can then feed into the development of evidence-based public health policy. At the level of basic ethical principles, we also believe that at the very least we must give the life and the death of the unborn child a statistical significance, because it was already decided, as we know, not to give the unborn child any constitutional protection or significance. For the record, and because it now seems we have to be very clear about such things, I want to say at the very outset that we have no other motivation in bringing this amendment forward. Recently, the broader issue on how information or data is used or presented has figured prominently in so many areas of our political life. Indeed, the potential impacts were considered to be so serious that we saw that the establishment by the Taoiseach's office of an interdepartmental group focusing on the security of Ireland's electoral process and disinformation. One of the primary concerns identified by that group's report, published in October, related to the potential effect that the widespread use of social media can have in accentuating any concerted programme of disinformation. In light of that, we can say with some certainty that the more controversial the subject, the more clearly established is the requirement for the collation of comprehensive, detailed, accessible and fact-based data. This point has been acknowledged by pro-abortion groups, and in one particular case study report, one such group found any meaningful attempt to evaluate the impact of a new abortion law. Where health data collection systems are inadequate, it says, and where the private sector provides the majority of legal abortions but is not required to report them, the incidence of legal procedures cannot be accurately measured. It ended by noting that public health advocates, international donors and researchers around the world should continue striving to improve the completeness of reporting of legal abortions, the recording and accurate classification of abortion-related maternal deaths, and the attainment of robust estimates of overall maternal mortality, and both legal and safe terminations and unsafe terminations. To speak more locally, my colleague Deputy Peadar Tóibín made the following point during the committee debate on this particular amendment. The reason that we are collecting so much data is that this is a very serious issue. This is an exceptional situation in historical terms. Up to this, we have only allowed for the ending of life in cases where the life of the mother was under threat, and this now is a radical departure. The point was also made at committee that this amendment is very much in line with the data categories required under the existing UK law around the recording of terminations, as well as the fact that it represents international best practice. So surely we should have systems in place to ensure that here in Ireland. In his reply to a similar amendment put forward by another deputy on the other side of the debate, Minister Harris said at the committee that if one looks at the website of the UK Department for Health, as he did during the referendum campaign, one will see the amount of data that is collected and sent to the department in the UK. While the Minister did not suggest that we should mirror what they do, he did accept, however, that they collect a considerable amount of data and stated quite clearly that he had no difficulty with this. The Minister also indicated that if the question was simply around the modality of how we get the information and put it before the Oireachtas or into the public domain, he would be happy to consider that further. I raise these points at this stage only to indicate that while I accept the committee did have issues around the modality of how we get the information, there was no fundamental disagreement around the necessity for the various statistical data sets to be actually recorded. The point was also made in the committee that it was somewhat unnecessary or unhelpful to be as prescriptive as this amendment is about the kind of information that ought to be collected. On this point, Deputy Donnelly asked if the data that is to be collected is usually provided for in primary legislation or in follow-up regulations. He also made the fair but very incomplete point that it would be onerous for those tasked with the drafting of public policy if in a few years' time they had to amend the primary legislation to allow for the collection of the particular information. I say that that was a very incomplete point for the simple fact that if he had read this amendment carefully through, he would have seen that provision was made specifically for, and I quote, such other information as may be prescribed. We all know that annual statistics and information on abortions recorded in England and Wales is based on detailed abortion notification forms submitted by clinics and hospitals to the Chief Medical Officer at the Department of Health and Social Care. The UK Department of Health then monitors the forms to ensure that there is full compliance with the legislation set out in the Abortion Act 1967. The UK Departmental Guidance Note for completing the abortion forms, which is intended to help doctors and clinical staff, also make it clear that certifying doctors are expected to have enough evidence of the woman's circumstances to justify that they were able to form a good faith opinion that the ground for the termination exists. Is it not far more likely, since we are dealing here with an assessment whose outcome involves the potential death of one human being, it is only appropriate that some consideration be given to the circumstances that are being offered as the justification for the abortion to take place in the first place. If there is evidence that a certifying doctor has not formed an opinion in good faith, then those performing the termination are not protected by the Act and may have potentially committed a criminal offence by terminating the pregnancy.